Okay, guys, we're going to talk a little bit about the different types of joints and different ways we classify those joints, and then the types of movement we see in joints. We've already talked about synovial joints in class, and probably by the time you're listening to this and watching this, we've talked about some specific synovial joints, but this is going to give you a little bit of a basis on the classifications of joints, including synovial joints, but there's other types as well, which you'll see. And then it's going to talk about the different types of movements that you will see with these different types of joints. Okay, so in general, the definition of a joint is where two bones come together, two or more. It doesn't have to be just two, but at least two. Okay, and this is known as the weakest part of the skeletal system. Okay, the main things that happen in joints are the joints are there to help provide shock absorption, obviously allow for movement, and the joints are there to hold the bones together. Without joints, we wouldn't be able to move. We'd be completely stiff, right? So the joints are very important. Even though they are the weakest part of the skeleton, they allow for movement. Okay, so there's a couple different ways that we can classify joints. The older system of classification is called the functional classification system. Okay, and what we see there is a few different types. The three names are synarthrosis, amphiarthrosis, and diarthrosis joints. Okay, and so diarthrosis are the joints that we typically think of when we think of joints. They have a lubricated joint cavity, and then synarthrosis is quite a bit different. That's when we talk about like this on the cranial bones, these bones coming together that are completely fused and there's no movement. So that's what it means, synarthrosis. That means without movement. And then there's amphiarthrosis joints, which allow for some movement, but not much movement compared to a diarthrosis joint. So synarthrosis joints are the joint between your tibia and your fibula here, and then we also see the joints between your vertebrae. Okay, for the most part, that system is not really used anymore. The new classification system is the structural classification system. That's the one that we typically use. And the criteria that we use to classify these different types of joints are based on the connective material binding the bones together, and then also the presence or absence of a joint cavity. So the three types of joints within this classification are the fibrous joints, cartilaginous joints, and synovial joints. And we've already talked quite a bit about synovial joints, but we'll talk here about the fibrous joints and the cartilaginous joints. Okay, so in fibrous joints, the bones are held together by fibrous connective tissue, mostly collagen fibers. There's no joint cavity, and this includes synarthrosis and amphiarthrosis types of joints, if you're looking at the other classification system. So there's three types of fibrous joints. One is the suture. The examples of these would be the way all the cranial and facial bones are held together. So the edges actually interlock. They're very short, thick fibers. Hold them together, and there's no movement at all. Okay, and then the syndesmosis joints, we have longer fibrous tissue with ligaments holding these together, but the mobility varies. There might be a little bit of movement, but definitely not a lot of movement. And then the last one is called the gomphosis joint, and this is pretty much a peg in a socket, periodontal ligaments holding these together. And this is typically talking about the teeth, how the teeth are held into the mandible and into the maxilla bones. Okay, so here's four examples of fibrous joints. Okay, and so if you had to guess, which one would you think was the syndesmosis joint? Okay, A is looking at the joints between cranial bones, so that's obviously not syndesmosis. That's going to be the suture type. Okay, and then the one here with the tooth, this is the gomphosis. And so then we have two examples of syndesmosis joints. One is the tibiofibular joint, the distal tibiofibular joint. This is the tibiofibular ligament. And so when somebody has what's called a high ankle sprain, this is actually what's ruptured here, what's sprained, this ligament here. So this joint doesn't move too much, but it does move a little bit. And then another example of a syndesmosis joint is this one here, where the radius and ulna are together in the forearm. Doesn't allow for much movement, but there is some movement. Okay, so B and D are the syndesmosis joints there. Okay, and then we have cartilaginous joints. So cartilaginous joints are literally held together by cartilage. There's no joint cavity, and there's just a slight amount of movement. So these are mostly considered amphiarthrosis joints. And then under this category, there's two types: synchondroses, which is where the bones are unified by hyaline cartilage. It's completely immovable, but most of this hyaline cartilage turns into bone. And then we have symphyses, and this is where bones are unified by fibrocartilage. Okay, so synchondrosis is hyaline cartilage unifying the joint. Symphyses are fibrocartilage unifying the joint. Synchondroses usually close, and symphyses are there for good. Okay, a couple examples of those. All right, so we've got a few different examples here, and so take a look at this and see if you can guess which ones would be synchondroses. Okay, so synchondroses again are places where we have hyaline cartilage connecting the bones together. Okay, so two examples. One here is A. So these joints between the sternum and the ribs. This is hyaline cartilage here, and that holds those joints together. This is an example of a synchondrosis that does not close with aging. C is an example of a growth plate. The hyaline cartilage in the growth plate. That, as you know, eventually closes. Okay, and then the two other examples are examples of symphysis type joints. Okay, so we have the pubic symphysis here. So this is fibrocartilage. And then we have intervertebral disc, which is also fibrocartilage. Okay, so two different types of cartilaginous joints. Okay, and then as we've been talking about in class, synovial joints. Okay, so this is the most common type of joint. There is a joint cavity, and it's lined with a synovial membrane that lubricates the joint. Okay, we talked a lot about that last Friday in class. And so there's different types of these joints, quite a few different types. Plane, hinge, pivot, condyloid, saddle, and ball and socket joints. So we'll look a little bit at each of these, and we'll look at the movements that they do. Okay, so this is directly out of your book, figure 8.7, and in your Master and A&P assignment, you have what's called a focus figure assignment, focus figure 8.7. So I'm not going to spend a ton of time talking about this because you have this exact information in your book as well as in that focus figure in your Master and A&P assignment. It shows it pretty well, but let's spend a little bit of time talking about these. Okay, so the first type of joint here is called a plane joint. Okay, the definition and characteristic of that is you have two flat surfaces coming together. Okay, those joints don't move too much, but they allow for gliding, which is which is called non-axial movement. Okay, so it's kind of just these bones sliding back and forth on each other. We typically see this between carpal bones, between tarsal bones, between these kind of small bones in the foot. These are the tarsal bones, and we also see this between the vertebrae with the superior and inferior articular processes. Okay, so that's a plane joint, which allows for non-axial movement. Okay, second is a hinge joint. So a hinge joint has a cylinder and a trough. Okay, so a perfect example of this is where the trochlea comes in contact with a trochlear notch from the humerus and the ulna. Okay, and so this allows for uniaxial movement, means movement in one axis. Okay, so that's flexion and extension. Obviously, your radius and ulna allow for flexion and extension when they come together, and that's being shown here. We also see this in the phalange joints. Okay, so those interphalangeal joints where your knuckles are, not your knuckles that are between your phalange and your metacarpals, but your knuckles right between your phalanges on your fingers. Those are also hinge joints, which allow for flexion and extension only, so one axis of motion. Okay, then we've got the pivot joint here, and so a pivot joint allows also for uniaxial movement, but it's more of a rotational type of movement. Okay, so a perfect example of this is where the radial head interacts with the ulna on the radial notch. Okay, and we also see this where the axis and atlas interact for allowing for cervical rotation. Okay, so there's one plane of movement, but it's a rotational movement. Okay, and you kind of have this one bone that's like an axle, and the other one's like a sleeve that goes around the axle, allows for rotation. Okay, then we have what's called a condylar joint. This is the first joint we'll talk about that allows for biaxial movement. That means for movement in two separate planes. Okay, so a good example of this is are the joints between your metacarpals and your proximal phalanges. Okay, so these are really what we think about when we think about knuckles. Okay, so that end of the proximal side of the phalange is a concave oval surface, whereas the distal side of the metacarpal is a convex oval surface. And so when those go over each other, you can see that you can do flexion and extension of your finger of that joint, but you can also move them back and forth, kind of like you're wagging your finger. Naughty boy, right? You can try that as we're doing it right now. And so it's two different planes of movement. One is flexion extension, just like gripping, and then the other one is wagging your finger back and forth. Okay, so that's two axes of motion, and that's a condylar joint. Okay, and then we have a saddle joint. So a good example of a saddle joint is this joint between your metacarpal, first metacarpal, and your trapezium. Okay, and this one is the joint that allows for the thumb to cross over the palm and allow for opposition of the thumb and the finger, which is one of the things that separates us from other monkeys and things like that, right? We have opposable thumbs, right? And so that's an important joint here. And so we see, so the saddle joint has this kind of a structure. It actually looks like the bottom part looks like a saddle, and the top part would be like somebody sitting on the saddle, right? It allows for movement in two axes, so this is biaxial movement. It allows for flexion and extension, just like the hinge joint does, but then it also allows for adduction and abduction. So that's adduction and abduction. Adduction means going towards the midline. Abduction means going away from the midline. Okay, so adduction is like you're adding something to the body, going towards the center of the body, and abduction, you're going away from the center of the body. And then finally, we have the ball and socket joint, which are two good examples of this are the shoulder, where the humerus and scapula come together, and then in the hip. Okay, and so this allows for multi-axial movement. Okay, so it's not exactly movements all in one plane, but it can access movements in all planes. Okay, and so we obviously had a concave cup kind of socket shape and then a spherical ball shape that goes into that. Okay, so this allows for flexion extension. So you can lift your knee up towards your chest. That's flexion of your hip. Pushing your thigh back towards your butt is extension of the hip. And we can also do adduction and abduction of the hip, which would be standing up straight and lifting your leg to the outside. That would be abduction, and then bringing your leg back in towards the inside of your body would be adduction. And then if you just stand up and rotate your toes directly towards the inside of your body, that's internal rotation. If you rotate your toes to the outside by moving your whole hip, that's external rotation. So we can do those all three of those motions in these ball and socket joints, and that's why it's called multi-axial movement. All right, and you guys can think about this clicker question on your own, but which of the following types of joints allow for biaxial movement? We'll let you think about that, and you'll also be answering lots of questions like this on Master A&P if you haven't already done that. All right, guys.